The time being 9 a.m. on Wednesday, October 20th, 2021. I'd like to call this meeting of the Kane County Public Health Committee to order. Clerk, please call the roll.
Silva,
Silva is here.
Lewis,
Lewis here.
Shepro,
Shepro present.
Strathman,
Strathman here.
Tepe,
Happy here.
Wallace, Sanchez.
Here.
You have a quorum.
Okay, someone ask for unanimous consent to approve the minutes of September 22nd?
I'll ask for unanimous consent, Mr. Chairman.
Asks, is there any objections?
Shepro, that is.
Okay. Minutes are placed on file. Any questions on the finance reports for the Public Health Department this month? No? Nothing? All right. Public comments on agenda and non-agenda items. I'll take both at this time. I understand there is someone possibly online who has a public comment. Sherry DeShazo. Sorry if I said the name wrong. Are they? Oh,
Hi.
she's here.
Hi, I'm actually not Sherry DeShazo, but she's on her way right now. I apologize. I'm Crystal Olson. I do government relations for Advocate Aurora Health. Sherry DeShazo, who is the president of Advocate Sherman Hospital, but will be on her way in just a moment. I apologize. I thought we were doing public comment at the end of the meeting.
Well, you know what? If you need some more time, we can do that after.
Thank you
At
so
that-
much. We
that
appreciate it.
point.
She had a board meeting this morning, so
problem.
she's on her way now.
Totally understand.
We
Thank you.
appreciate you.
So
Thank
I'll
you.
call for that then after we go through all of our other.
Thank you so
business.
much. We appreciate you.
All right, we have the executive directors section. Kathy Foster, take it away.
Good morning, everyone. So we will start off with our update on COVID-19, and Ms. Uche Anwuta, our Director for Health Protection, will begin.
Good morning. Thank you. Good morning. My name is Uche Onwuta, and I'm the Director of Health Protection.
Is your mic on? Uche?
Mike, please.
Some of those you have to really sit on top of. Yeah.
Can you hear me now?
Yeah.
Okay. So I'm here to give you the COVID-19 update for October 20th. So a little bit information about the vaccination rates for Kane County. Right now, a total of 278,000 Kane County residents have been fully vaccinated, which is 52% of our population. 68% had at least one dose. And for the 12 years and up, 62% fully vaccinated, 81% one dose. And for the 18 years and up, 64% fully vaccinated, 83% one dose. And for the 65 plus, 77% fully vaccinated and 96% with at least one dose. This is the CDC data, and I always like to give you also the IDPH vaccination rate for Kane County is 57% as opposed to 52.3 that CDC posts on their website. So there's a little disparity. So Kane County is still in high transmission because we have case rate of almost 120 per 100,000. And even though our positivity rate is lower at 3.13%, because of the high case rate, we're still in high transmission. We've had a total of 68,000 plus cases and 868 deaths. So what that means is that we're in area of substantial or high transmission. So CDC recommends that that people wear masks indoors in public places.
Excuse me, over what time period is this cases and deaths?
Over the entire pandemic, 68,000 cases and 868 deaths for King County. So this is age-specific case rate per 100,000. And is it the yellow? Okay, so you can see that the under 20 has the highest case-specific rate, age-specific case rate, and the lowest one is, I believe it's 80 plus. So there's a lot going on with our young young people. Currently, we have school outbreaks, about 10 school outbreaks going on right now. So the last time I made a presentation, I was asked to get some information about hospitalization for children. And so this is what I was able to put together. It is looking at hospitalization among children under 18 years old by month of onset. So you can see. So you can see when we had a high surge beginning of the school year. This is by month of onset. So even if the hospitalization was 2 or 3 weeks later, I preferred onset because that's when they had the exposure. So you can see that August, September, we had our highest and it's been on the decline. Again, looking at COVID-19 variants, we had 99.4% of cases sequenced were Delta variants. So this is a list of the Delta variants. Most of them, the B1617.2 and the AY sublineages are all Delta. There's only one, which is the B1, that's not Delta. Everything else was Delta. Just a highlight of our contact tracing. Okay, so you can see that we're kind of leveling off. It's not like we're on the decline. You can see what the decline looks like. We had a steep decline here. We're kind of leveling off. So we're not quite out of the woods yet. And we're doing a lot better with our response to, within 24 and 48 hours, we're able to make the initial outreach within 24, 48 hours to our cases and our contacts. We're still working on completing our interviews, get them to 100%. We're kind of like halfway there. So we're headed in the right direction, and the numbers are looking a lot better than.
OJ, if I could just interrupt real quick, that top left box for everyone who's looking at this, you can see at the bottom of that top left box, the most recent completed 24 and 48 hours are at 96% and 100%. Those are really good numbers. That's why a couple months ago, we asked for an increase in the staffing at the contact tracing operation, because our numbers had dropped down so low. We were seeing such a huge surge of the Delta variant. Our response times went way down, which meant people weren't getting back to work and school in a timely fashion. And now they're getting contacted almost right away. maybe even before they get the virus, they're getting contacted at this point. And that's humor. Nobody's awake yet. But it's just really good to see that. So thank you. It just shows that it worked. The increasing the staffing for the contact tracing worked, and it was a good move. So thank you.
Jepro question. Is that also perhaps due in part because the number of cases have dropped?
Yeah, the number of cases dropped, but because we were not responding on time, we had a backlog. So we have been able to address the backlog and get back on track. Yeah. So my last slide is just a little bit as we're getting to the holidays and people are thinking about, should I have a Thanksgiving dinner, Christmas? We have a trick or treat coming. So I thought I'd address a little bit about the holiday guidance. Outdoors is better than indoors. I mean, I know that we probably can have Thanksgiving dinner outdoors. However, smaller groups are better than larger gatherings. Ultimately, the most important thing is to vaccinate. Those who can vaccinate, we encourage them to vaccinate so that we can protect those who cannot vaccinate. Our younger children who are not in the age where they're able to vaccinate, if we can increase our vaccination rates, we can better protect those who are unable to vaccinate. Wearing masks in indoor public settings, observing physical distancing. The mask doesn't cover 100%. We still want people to be conscious of who's around them and observe physical distancing. Proper ventilation in indoors is essential. Open your windows, crack open the doors so that there's exchange of air. Avoid crowded settings. Consider small gatherings outdoors. So for trick or treating, since it's mostly outdoors are preferred and in smaller groups. Encouraging people who come to the door, to put on a mask when they're handing out the candy. Haunted houses, if we can have open air haunted houses, those are preferred. So think a little bit about how the virus is spread and take precautions appropriately. I think that's my last slide. Thank you.
Mr. Chair.
Yes, could we go back to the first slide with the vaccination percentages? I guess not literally the
The second.
first slide, probably the one
One more.
with the vaccination percentages.
Yeah. Mhm.
How are those numbers changed, say, in the past month or past 2 weeks?
There's not been much change. The people are trickling in to get vaccinated, but we're not seeing a lot. So we're kind of slowly inching up, but not by as much rate as we had earlier.
Yeah,
in the
I
year.
mean, I guess what I'm asking is there any substantial new incidents of people being vaccinated, or is it slowed?
It is slow. I think we were at 50, maybe 50% or 51 the last time. And now we're 52.3. So yeah, it hasn't changed by that much.
And what are we doing, or what is being done to identify and seek out the unvaccinated people? I mean, is there anything new being done with respect to that? Or are we relying on newspapers, TV, radio, text messages?
Good question. We've done all kinds of things and, my colleagues can help me out with,
Michael, do you want to talk about the marketing piece?
So we do continue to work with community organizations. So we have, as you mentioned, we have print campaigns going. We have items that are up in the bus shelters in English and Spanish where we've targeted specific neighborhoods. We do know by zip code where we have the lowest rates of immunizations. So we know on the east side of Aurora in the 60505 area code, that's our lowest vaccination rate in the county. So we've been working with churches and community organizations to stand up clinics in the neighborhoods. And we have, through a grant program with the Illinois Department of Public Health and the Illinois Public Health Association, where they actually pushed out about $8 million for what they're calling a navigator program, where they have people who are actually going and talking to people in their neighborhoods to try to make it as interpersonal as possible so that it's somebody they know and that they trust. But we're also reaching that point, and I think people know, and even within their own homes, where the resistance is, we're hitting that wall with people. So people who haven't been able to get vaccinated yet, we feel pretty comfortable that we're at a point where that's because that's a choice they've made rather than an access issue.
That was going to be my last question. Are we, because anecdotally, it seems like the people that I know who haven't been, it's not that they can't get there or can't do it or can't, but they just don't want it.
Right. And so we're still trying to change minds, but I think that's an accurate statement that you made. And I think in terms of people 12 and over who are vaccinated over the past couple of weeks, we've gone up about 1.5 percentage points, which is really slowly creeping up. But if you think about where we're going to end up, we're never going to reach 100%. So if we got to 90 from, and I'm looking at just the 12 and over people who are currently eligible for vaccine, 1.5 percentage points out of, say, a 10% goal that we have left is, and that's if 90 is even our goal. 90 is pretty darn high. We're still making progress. So it's extremely slow, but every person that gets vaccinated is helping the cause. So still good progress.
I guess I did have one more. The discrepancy between the fully vaccinated and at least one dose, particularly for the 65 and over, what does that mean? I mean, does it mean a lot of people didn't want the second dose, or they're recent patients who haven't gotten it yet?
Yeah, it is a mix of both, but I think there are some people that we were successful in getting them into their first dose, but not successful in getting them into the second dose. So a small percentage of those folks are still potentially within the window where they could go in and get their second dose. But we know there was a lot of people who are hesitant. Somebody in their life was able to at least get them to show up once. But I think those numbers are pretty small in terms of how many people are still due for their second dose.
Thank you.
I have a question.
Madam Chair.
Hi, good morning. I just heard on the radio coming here, and we've all been waiting for this good news, that early in November, the vaccine is going to be approved for children. Are we making plans for that? Are we promoting it? I heard in schools. They may be vaccinated in schools as well. We've got our own little clinic that we're going to have. What is going to be our outreach in that? And then is that also, to follow up on Mr. Shepro's question, can we then encourage the late parents, since their children will be vaccinated in, is there parental, there's a lot of questions. We have masks that people are very concerned with. Now next, between the masks and now perhaps the vaccine, what kind of uproar or concerns, and uproar, I'm using that in quotes, voices of concern that may be concern of tenor in their voice will be caused by this, and how are our school nurses prepared to take on this raise of issues that potentially may happen? If that makes sense. I'm trying to be as politely apolitical
Absolutely.
as
So
I can.
I'll defer to Laura Barrett, one of our directors, to talk about the advent of the vaccine, and then maybe we can circle back to some of the
Okay.
school nurse stuff.
Okay.
Sure, there's a lot in the news this week, not only about the pediatric, but also the boosters for Moderna and Janssen. So I have the most recent information we just got on Monday morning from IDPH here. They are set for the pediatric vaccine to review that by the VRBAC group. They make their recommendations. That is scheduled for October 26th. That will then go to ACIP, which is another advisory group that will review the data. That will be done on November 2nd and 3rd. They're scheduled to. After that, it goes to the CDC for the director then to sign off on final recommendations for the pediatric virus vaccine. So we do not expect to see that out until probably that second week in November to be available. They are ready to begin shipping vaccine orders as soon as that has been approved. So we can start pre-ordering vaccines. The vaccine is very different than the adult one. So you cannot mix the adult adolescent Pfizer vaccine, and I'm only talking Pfizer because that's the only one that's in the process for right now. It cannot be mixed and given to a child from 5 to 11 years of age. So they are two different vaccines. They are mixed differently. They, of course, are administered the same way. The dose is different. So all vaccinators will have to be retrained on this vaccine so that we can safely provide it to individuals. We do not know if it's a 1 or 2 dose series at this point. We are still waiting for that information. The product comes in a completely different product. It's packaged differently with it, and we will have minimum orders of 300, and then it goes to 100 doses with it. The storage of this is going to be challenging. Again, it's going to be in that ultra cold storage. We only have 6 months versus the 9 months for the adults, so it has to be very carefully watched. We cannot put it into a freezer for 2 weeks like we do the adult dose. And then for the actual administration, the refrigeration time, we do have a period of 10 weeks. This is very important because currently right now we only have a few weeks with the Pfizer that's out there, which is making it very challenging for providers to carry the Pfizer because they have to order a minimum of 1,170 doses. And the period of time that they have to work with it when they don't have that ultra cold freezer limits their ability to give that vaccine out in a physician's office. So this 10-week period will allow our physicians to carry that in their office for 10 weeks in the refrigerator. But once that vial's been punctured, there's 10 doses in that vial. It is only good for 6 hours. There's no additive in there. It's not unit dose. It's not single dose administration. So at the end of that day, they'll have to, at 6 hours, they'll have to throw that vial away with whatever's left over with it too. So there's a considerable amount of waste with this process too. So pharmacies are expected to be administering the vaccine also. So as you talked about, who's going to be administering, I heard on the radio coming on in, CDC is outreaching to all of our major pharmacy chains, and they will be reaching out to see if they're going to be able to provide this on site for vaccinations, as we are working with providers and we are working with our healthcare systems throughout the county to understand their ability to provide this vaccine as an emergency use authorization. Obviously, it'll be underneath that listing with it. So until we start seeing that come through, we are making those plans for it. So to get back to your question that you asked, I'll probably give you more information than you needed, but the plans are being placed right now. We got the guidance from IDPH for pediatric vaccinations this week on Monday morning. We are working through that and working through our local pharmacies and our local health systems to see what their capacity is going to be. And we're also working with our FQHCs centers throughout the county to also see what their plans are also with it. And based on that, we will pull together an entire plan for the entire county then.
Thank you. If I may, are you going to be also speaking with Pat Del Santo as well? And that she can, as a former school board member, I'm concerned to make sure that our children and parents who are willing and wanting to get the vaccine can do so without feeling the concern that there's going to be any kind of pullback from them. because some of our school boards are very active against even the masks right now. And I want to make sure that those parents who feel that their children are going to be not vaccinated can feel as comfortable with that choice as the parents who want to make sure that their children are vaccinated. So there's no feeling of confrontation. And I have to use that word, so that all choices are respected. And then if those children are not vaccinated, parents or if the child wishes not to get vaccinated, will they be, what's the outcome? Are they going to be, everyone is going to continue to wear masks? Are those children going to be mandated for testing? How is this going to work to differentiate those who are vaccinated versus not being vaccinated? And what concerns then are we going to face as a community with those choices?
Yeah.
Great
So,
question.
right now, students who are vaccinated, the benefit is that when they're exposed to a case as a close contact, they can still get back to school and test within 3 to 5 days. Now, unvaccinated children will have to quarantine for 14 days. So there's a benefit to getting vaccinated. And, the parents know it because quarantine, especially for those in sporting activities, where they cannot play sports, but if they're vaccinated, they can go back to school. So,
And I know that we had a shortage of help of staff to be able to get those letters out back to the schools saying that the child now is safe to go back. Has that been addressed, and are we at full capacity now to assist this next effort? Because there may be more individuals needed at that point.
yes, Madam Chair, and I can share this with you.
I don't mean to jump ahead, but
We already went through it, but right
okay.
now we're
Thank you.
at 96% within 24 hours and 100% within 48 hours for cases, and 98% for within 24 and 100% for 48 hours for contacts. So yes, we're responding to.
As the additional need may come up because of the pediatric vaccines, we have the capacity to ramp that up.
Yes.
Okay, good, thank you.
Mhm.
That relieves me greatly.
Mr. Chair,
Ms. Bates.
are we getting ready for booster shots? How's that going to affect the county?
Are we doing it?
I'd like to thank you for all the hard work you do. And I'd like to thank everyone in this row for setting a good example and wearing your masks inside as the guidelines say. Thank you.
Laura, do you want to?
Sure, I can talk about the boosters a little bit also. So just a quick update on boosters. We are currently providing boosters for the Pfizer. It is 6 months after their last dose of the series. So those are available at the CaneVax Hub and at all other locations that the vaccine is out there. The dose is the same as what you received in the first two with the Pfizer. Verbeck unanimously approved both Moderna and J&J booster. Again, this is updated from the IDPH call on Monday morning. The Moderna booster is expected to go through and review this week with ACEP meetings set for today and tomorrow for both Moderna and the Janssen booster. Right now, the current understanding from Moderna is it's going to be a very similar group to have the booster as Pfizer is. It's over 65 years of age, 18 to 64 with a high risk of severe COVID, and 18 to 64 with a heightened job and institutional exposure. The expectation at this point is that Moderna will be following that same guidance. Janssen, however, is a little different. And then the Moderna is also looking at a 6 month after your last dose of the series. Janssen & Janssen's looking at all 18 and older in at least 2 months after their single shot that they received. So that's the current understanding. That may change today and tomorrow as we go through with that. And then again, of course, the CDC could change that as they did with the Pfizer too, as that goes through that process. Boosters for Moderna and Janssen's cannot begin until the CDC releases its recommendations. We do not expect that until the end of this week or possibly the beginning of next week. So these meetings have to get cleared and then we will be ready to provide those. Right now, the Moderna dose is at half the dose of what the Pfizer dose was. So some of the questions I've had from individuals, and just to share what we've learned in our training on the boosters, is some people have had some reactions when they had their first and second doses to the COVID vaccine. And some kind of were a little bit more than feeling a little punk the next day, as I say, kind of down. The research that we've seen so far is when you get that booster dose, that third dose, you do not have as high of a response or side effects as you did from your second dose. So typically it's a little less intense than you had for your second dose. If you had any side effects, about 50% of people do not, some do. But for those who do, you should expect a little less intense response than maybe you had if you had side effects to your second dose. And then the other question that's out there, I'm sorry, sir. Go ahead.
Oh, no, if you're still answering. go ahead.
No, I did.
Yeah, the other part that's out there that's being considered this week that we're watching closely is the mixing of the doses, meaning if you've received a Pfizer, can you get your booster as a Moderna? If you received a Janssen, can you get your booster as a Pfizer? That guidance has not come out yet. We are still watching for that research and then that guidance to come on out, but that is being discussed this week also, which will throw another understanding how soon afterwards for those dates, those times, dosing, that information is yet to be shared yet.
Mr. Shepro.
Thank you. Thank you for a really detailed presentation on the children's vaccine. I was wondering if there was an article or information that you could send us a link to if we wanted to read more about that.
Absolutely, would be happy to share that with you. And once it comes on out with the final recommendations, this was information that was shared from IDPH and was not really ready to go viral too much yet, as it could change anytime as these committees go on through. But as of Monday morning, this was the current process that was going on. And we expect there'll be changes in the next 48 to 2 to 3 weeks for both of these, the boosters and the pediatrics. So
There just seem to be so many differences that I'm kind of interested to read a little bit more about that.
Any other questions? Mr. Brown.
Yeah, I've got a question. For the statistics on the amount of people being vaccinated, fully vaccinated and partially, where does the booster come into that? Is that not included in the fully vaccinated, or do you need to have the booster now in order to be fully vaccinated?
That's a great question. And that was posed to CDC on Monday, and they had said that for now, they're not able to separate the booster doses from the second dose. So, but they said that with time, they'll probably be able, for now, it's all included in there.
Okay. The other, I do have another comment or observation, I think, and to piggyback on Ms. Bates commenting on everybody from the health department still wearing their mask, and everybody that's not with the health department, with the exception of Ms. Bates, is not wearing a mask. And Michelle, I'm sorry, I didn't see you. But I'm sorry, Corinne. But where I was going to go with this before I even noticed that was I sit on the Judicial and Public Safety Committee, and one of the elected department heads that reports to us is the coroner. And in his report for the last 2 months, it's been quite shocking the amount of COVID deaths that are reported. September of 2020, there were 8 recorded COVID deaths. Now, we were in the heart of COVID. We all remember how severe we all thought it was at that point in time. In September of 2021, there were 37. Now, that's really an alarming number. And I'm wondering, do you think that that's because, as you see in this room, a lot of us have kind of let our guards down and maybe we shouldn't be? I don't know who could answer that. Maybe all of you could, but
Yeah.
it's just an observation that I saw.
That's a great question. And for the record, we should all be wearing masks because we're in a public place and we're indoors. In September last year, and this is the thing with COVID, is when the cases start going up, when you see a surge, the deaths are low. The deaths come a little bit later. It's like a lag of about a month. So if you remember last year, the numbers went down. See if I can't read. Okay, so this is September of last year. So the numbers were kind of low. You remember we came down from the highs and then we're kind of coasting until somewhere around Halloween, Thanksgiving was when the numbers started going up. So if this were a death chart, the deaths will be down and then they start going up. So the deaths lag behind the increase in incidence of cases. So that's what happens. We had a surge August, September, and then the deaths are now, even though our cases are coming down, the deaths are going up because that's what usually happens. The cases get severe and then the deaths start happening.
Okay.
So that's, yeah. Unfortunately, this has gone on for almost 2 years and people are kind of getting tired and
Right.
letting their guards down. But I just want to encourage people to stay on course because the sooner we can get this over with by increasing vaccination and taking precautions, the sooner we can get back to what will be new normal.
Thank you.
And isn't it also because of the Delta variant has entered in? And so now the COVID has transformed into a new brand of COVID with the Delta variant, which is much more transmittable.
Yes, and it's much more transmittable, and the breakthrough cases are more with Delta than the other variants. So, and I hear people say I'm vaccinated, so I don't need to wear mask, but even with vaccination, you still can get a breakthrough case. So yes, because of Delta, the incidence is, Delta is really wild. It comes quickly and yeah, but the precautions are all similar. Nothing has changed in terms of precaution.
Correct,
Yeah.
correct.
Lewis online, permission to speak?
Go ahead, Lewis.
Thank you. Back to Mr. Shepro's comments earlier when we were talking about the unvaccinated population. 60505 is my area code. It's the east side of Aurora. And Dr. Silva's familiar with it too. Not a Saturday goes by where you can't go to a flea market or a school event and they're trying to get people vaccinated. So we're continuing to push it. It's just that population it's just like I think you said, it's like getting one or two here and there. But if anybody from the health department, if you guys have anything that you would like myself, to push forward more, being a resident of that side, I'd be more than happy to do it.
Thank you, Ms. Lewis. Anyone else
welcome.
with questions or comments on the COVID-19 update? Okay, thank you very much for the presentation.
Thank you.
All right, Kathy, what's up next? We have the organizational project update.
Okay, yes, so the organizational project update, I know some people already are aware of it, the ones that are, I think, on Human Services Committee. And so some of you may not be. This was a project that was initiated by Madam Chair, and it is, a contractor has been hired to gather information from us employees on the health department The information that's going to be collected are about our current and future, possible future services, our staffing, current and future, and key director qualities is also going to be another thing, and workforce environment and productivity, which actually is going to be helpful to our strategic plan that we're going to be talking about next. So this is a project that's 2 months. So I sent out an introductory email to all our staff on October 6th. I have communicated with the union on October 7th. And let's see. And we had a management discussion with the contractor to make sure the questions were, if there wasn't anything else that was being missed, on October 14th. And then our interview, we had an information session for all our employees so they would feel comfortable to schedule their interviews and understand what was expected. That was this week on October 18th. And the interviews have begun, and the completion of these interviews should be around November 1st. The name of the contractor is Pat Farah. My understanding is it went to Human Services because of staffing, specifically because of staffing, but if anything that is program related will come to this committee. That's my understanding of it. So I'll take any questions because I know some of you might have not have been aware of this.
Are there any questions on this? Yeah, so this is definitely a good thing to help us as we get towards the search for an executive director. Taking a look at the organization, strengths, weaknesses. It's not going in there to see which positions we could cut. It's nothing like that. It's not an efficiency expert, anything like that. So really, it's only going to be to the benefit and the health of the organization in total. So I fully support it. Anyone else have any questions or comments on that? Okay. We do have a resolution. If I could just get a motion in a second to discuss and potentially pass authorizing Kane County Health Department 2021-2026 strategic plan.
So moved by Silva.
Let Silva move it.
I'll second.
Shepro seconds. And is
I-
Claudia
I
gonna?
did have a presentation. I'm sorry that I was.
Oh, you have a presentation on it. Well, that's,
Yes.
I wanted to just.
We
open it.
have to put it on the floor first too.
That's how I prefer to do it usually.
Oh, okay.
So go ahead with the presentation.
All righty. And I forgot to get the clicker. So last month, we gave you an update. I believe it was last month or the month before on the strategic plan. So some of this will be a repeat, but I just want to give you this information. So, you have it on the basics of the strategic plan. All right. So the King County Health Department needs to have a 5-year strategic plan. This is something that's a part of our certification, our accreditation. And of course, it's a good map for the King County Health Department going forward for the next 5 years. So we did a very broad overview, so you guys won't be sleeping through the presentation, because I know people's eyes glaze over with strategic plans, but, oh, good. Oh, okay. I think I hit the wrong arrow, sorry. Okay, so as we know, a strategic plan, this is going to define the health department's roles, priorities, direction for the next 5 years. It's going to determine what to achieve, how to achieve it, and how the health department will know what once we've achieved it. And we do have a performance management system in place now that is related to public health. So we're very excited about that, because we did not have that last time out. So we're very excited about having that. This will guide decision-making, allocating resources, identifying strategies, and defining priorities. And obviously, it's key to effective management, and it has to be flexible and continuous. And I know there was a question about it because we're doing this before the new executive director is hired. But this plan, which I sent out, we sent out the draft to everyone. It can be revised. It's not in stone. It can be, so if a new executive director comes in and sees something, or we find out information on the project, we can always revise it. So because you're passing this, or, consider passing this resolution today, does not mean that, oh no, this is just passing that the health department can have a 5-year strategic plan. Next is the timeline. Am I pressing the right button? Oh, there it goes. Now I went too far. Okay, so I'm going to just briefly go over the timeline. So back in June of this year, we looked at environmental scan, and we identified stakeholders. We had many different stakeholders. Claudia, it was the project owner of this and gathering everyone. She did a fantastic job getting all our stakeholders together to get information. Surveys went out. Hopefully you all were able to participate in that and provide information. And that's how we were able to complete our SWOT analysis in July. And we were able to get cross-cutting themes, which were discussed at that time. We had meetings, formal meetings for these. In August, that's where we identified our strategic issues, which we brought forth in the last update. We finalized strategic priorities and defined them, and identified specific goals and objectives, which we're going to talk about in the next slides. So September, October, this is where we are now today. We're going to, last month, we already got Health Advisory Committee Board information. So we did present that. We reviewed and comments by the King County Health Department employees. So we sent out a survey. We were able to get their information. So when we're forming the goals and objectives, all their inputs were considered. We had our strategic plan draft done, which you all should have received. And then today, this is where we are today with the resolution. So we're hoping once this goes, then it'll go to executive and then to the county board, and then it should start for the new fiscal year in December, our 5-year going forward, December 1st. So this slide will look familiar. This is what we had before. The strategic priorities have remained the same: health equity focus, communication, workforce development, resource development, and strategic collaboration. And each one has a leader assigned to them, which we all have here in attendance of the meeting today. So with the first one, I will let Ms. Uche Anwuta, who is the owner of Health Equity Focus, and I will let her briefly go over this priority.
Can you hear me? Sorry about that. So health equity, as defined by Adewale Troutman, is the realization that people of the highest attainable level of, that people have the realization by people of the highest attainable level of health. Achieving health equity requires valuing all individuals and populations equally and entails focused and ongoing societal efforts to address avoidable inequalities by ensuring the conditions for optimal health for all groups. So our task is to make sure that all King County residents equitably access healthcare. And I love this image. If you give everybody the same resources, not everybody can achieve, get across the fence. But if you give them what they need, some people might need a little bit more resources than others. That's what health equity is about. It's not equality, it is equity. So we have two goals. The first goal is to address access to programs and services. And the second goal is engaging the community we serve in our health programs. Next slide, please. So we propose to improve our translation services at the health department. We need to make sure that we have translation services for documents. We've noticed with COVID, the guidances are coming out every minute, they're changing. We have to be able to retain resources that can help us quickly translate documents and not have to rely on resources that are not reliable and consistent. Implementing annual cultural competency training for our Kane County staff, train the staff about health equity, and then do a train the trainer for the community, and partnering with trusted local minority organizations. So with that, we hope to, as our measures of success, to have a reliable translation system, and that employees are knowledgeable and skilled about communicating with diverse residents, whether they're hearing impaired, challenged with technology, or whatever the situation is, whatever language that is their primary language, we want to be able to reach them with that language. Kane County employees are consistently engaged in health equity efforts and collaborating with diverse community in planning public health initiatives. We're so used to telling people what to do. I was listening to the radio this morning and somebody said, people who make decisions are those who have higher education degrees, and we're making decisions for people who have little education. How do we know that what we're telling them is what they really need? So whether it's true or not, we have to include and engage the community we serve in making the decisions for them. So that's what the health equity priority is hoping to achieve. Thank you.
Okay. Okay, and then our next initiative, strategic priority, is communications, both internal and external. And Michael Isaacson, Assistant Director of Community Health, is overseeing this initiative.
Great, thank you. So basically with this initiative, what we're looking at is both internally and externally, how are we effectively communicating with our key stakeholders? So especially through the COVID pandemic, we have seen that we have opportunities for improvement, communicating current relevant information to our staff in a timely manner to make sure that everybody has the information that they need when they're communicating with the public to be able to give them the correct information. So we currently are doing an assessment of all internal communications, and we'll be increasing the amount of information that we share with our staff on an ongoing basis. On the external side, it's just continuing to position the health department as a resource that can get people what they need. You will notice there are some cross-cutting things between the different groups here. So as Ms. Onwuta just mentioned, making sure that we have the appropriate level of health literacy, that the message we get to people is the message that is relevant and is something that people can act on. I think it goes to some of what Madam Chair was saying when we're talking about some of the tension in schools and strong different beliefs about masks, about vaccine. We need to reach people where they are with messaging that is going to be of use to them in that point in time. So we're going to look at some different branding strategies, as well as continuing to get feedback from our stakeholders and our taxpayers for how we're communicating with them. Thank you.
Okay.
All right.
And
That's all right.
there isn't anything more to cover on that slide, correct?
No, I
Okay.
think I can answer
Excellent.
questions, but I think for
Okay.
time, that's good.
Excellent. So the workforce development one, that is under myself. And so this aligns directly with our public health accreditation, one of our domains, and it's actually continuation from the last strategic plan. So I'm happy that we still have this one, that it was definitely identified. So we want to continue that all of our public health employees are, meet all the criteria for training and professional development. So that's the number one goal there. And then that we want to have a work environment that's supportive of all our staff, and so they can do the best job that they can do for helping the community. So some of these measures of success will be that all employees complete annual required trainings, that they meet annual cascading performance goals. And when we say cascading performance goals, it's so they understand their individual goal, how that affects the big picture, to make that a simple area, so they understand how important their jobs are and how connected. And so other performance measures are that all employees have the opportunity to participate in succession mentorship programs. So this will be something new for us. And we're excited that this will be something that will be, so other people can evolve and have the opportunity to evolve into something else, or maybe if they don't, but at least they have the opportunity to participate. And then that we retain and attract quality employees with competitive wages, benefits, and a supportive work environment. So there's a lot of different things that we'll be doing for that, and the highlights are the program. We also have, through our union, we have an employee involvement committee. So we will be relying heavily on making sure that they're involved in the process, so they can present ideas. This isn't just about leadership this is everyone in the whole organization. So I'm very excited about that. We also have the IDEA, the Inclusion, Diversity, Equity, and Anti-Racism Program. This will be down the line. I know, as you guys probably saw in there, there's definite 5-year progression. So, this will go through the program. And then updating employee recognition program. We just want to check and see, maybe there's some things that we could definitely improve upon for that. And then to assess our facility needs and implement improvements would be one of the things we would like to add. So let's see. And with that, we have our fourth one. Resource development, and Paul Kofer, who is our grants management specialist. He will be presenting on that today.
Hi. In the resource development group, we're going to be looking at resources in the sense of all program inputs. So in a very broad sense, we're going to be identifying each program's resource needs, that's historical, current, and projected future needs. And we're going to be looking at how we prioritize and evaluate needs, and also seeing, are there resource needs that are held in common between multiple programs within the health department. You can advance the slide. Oh, thanks. So we're going to create an assessment or a report on our current and future needs and present that to the staff. We're going to see what's likely to be available in the future, and what we'll need in the future as well. And we'll present that data and the assessment on it so as to allow ourselves, wise decision-making in the future, and allow informed decision-making with regard to the whole spectrum of resource needs, particularly in consideration with, restricted or limited resources that might be out there in the future. And that will also allow us to capitalize on resources that are out there, and develop more and more thorough community engagement.
All right, excellent. Thank you. And then last but not least, our strategic collaboration initiative, which is led by Laura Barrett, our Director of Disease Prevention.
And just to kind of quickly summarize both these next two slides is, as Michael has already said, with COVID, we had a great opportunity. One of the opportunities with COVID is to really work with a lot of different areas throughout the county in those collaborative partnerships as we were working through COVID the last year and a half. It's been a great opportunity to be able to engage them and to see with the health equity, looking at where we may have some gaps or some opportunities to help support those programs or them that we can start to focus in on. So this is basically what this group is going to be looking at, is to do an evaluation of those community partners that we're engaged with, see if there's any gaps and any opportunities we can help support them in meeting our health equity goals and our communication goals. And then also working on internally finalizing those memorandums of understanding and affiliations as we work with sharing data and information back and forth. The second goal is more of an internal goal, and that's we're working with our staff for understanding who's working with each one of these areas with it, so that we're not doing too much overlap, and so that makes us more efficient. And then optimizing and integrating the IRIS system, which is a referral and information system that we use throughout the county for our services. So we'll get that rolled on out to the staff. And so those highlights are just as I had said, that just to get them some effective partnerships, electronic management system for the MOUs and affiliation agreements, make us more efficient with that, and then develop and implement an electronic consolidated referral system for the staff and get them trained on it.
All right, thank you. And with that, we'll take any questions.
Any questions or comments on the 5-year strategic plan? No? Madam Chair.
I know that these strategic plans take a lot of time, effort, very thoughtfulness as well. And I want to congratulate all of you for completing this task and allowing the flexibility for future change as the 5 years evolve, knowing that there's going to be new stressors, new opportunities presented, and the plan can adapt to those current needs. So thank you for your efforts on this. Well done.
All right, I think we're ready for a vote. Clerk, please call the roll.
Lewis. Lewis. Shepro.
Shepro, yes.
Strathman.
Strathman, yes.
Tepe.
Tepe, yes.
Wallace.
Wallace, yes.
Silva.
Silva, yes.
Sanchez.
Yes.
Passes.
Okay. Next up, animal control.
Question for,
Mr. Chevrolet.
yeah, just a question for the executive director. There've been a lot of things in the paper lately about shortages of key personnel, teachers, teachers' aides. And I was wondering what the latest status is for the health department in terms of vacancies and critical needs.
Okay, so yes, we do have current openings. I believe, Michael, you have quite a few, right? And that you have a couple in the tobacco program.
Right,
And-
I do have a couple positions that have been posted, some over 6 months that we're getting very few applicants for.
Yes, and then Laura definitely has some public health nurse
And a receptionist.
and a part-time receptionist. And then Uche definitely has inspector. We're still waiting for.
Oh, I didn't even read it. I'm about to go. I can read it since I'm done.
So, yeah, so we definitely have a need, and that's why one of the goals in the strategic plan is to be doing a compensation study plan, because we have to change our starting wages because we're not keeping up with the competition. The starting wages are from 2007. So we need to change that.
Carl.
Kenyon.
Do the local colleges offer training programs that would fit your needs? The other, I think when we talk about helping people, if we had scholarships who would allow people to go to school to get the training to fill these slots, we'd jump ahead of things.
Yes.
I mean, I'm talking about the money we have hanging out there. What do we do with it?
Yeah.
It seems to me, you just don't walk down the street and find anybody that can do your job. I mean, maybe you can do it to flip burgers, but not work in
Right.
a health department.
You can't find them either. Right.
Oh, I'm sorry, if I may. So are you suggesting, or could we, you're not suggesting, but could we consider that if money is budgeted for a salary, and the board has approved that budget line, and we put out that call for an employee and no one comes, could we allocate a portion of that money for junior college resources for training? So that we would hire an individual as a student slash intern employee. It'd be very progressive to be able to use that so that we would support them to get their certification, their 2-year certification. 4-year, I think, is something we can, I think that's kind of a robust decision depending upon the academic institution, but certainly 2 years relatively affordable and may attract employees to get that certification. It may be something that perhaps we'd want to consider through finance and through admin to see if that may be a possibility. If the money's already budgeted, with that, it's just a consideration to see if we can get some trained employees, to your point, working through the junior college as part of workforce development.
Seems to me it'd be a long-term investment to Kane County's future. A scholarship program made available, and I don't know how to do it otherwise, but you know, it costs money to go to school.
It does, it does. And for them to be able to work part-time and to go to school with that level of compensation that we've already put in our budget may be an appropriate use of that money, and then guarantee through some kind of personnel signed contract as appropriate and vetted that they would have to commit for a certain period of time to service to Kane County to that health department.
Ms. Bates.
Thank you. I'd like to add to what Madam Chair said, which is that many of the offerings from our community colleges are certifications, which only require 3 or 4 courses to receive the certificate. It's not 3, 4, 5. It doesn't mean a full associate's degree. So that would be even easier to accomplish.
Ms. Gumps.
I think it's a great idea. However, we keep dancing around the hot potato, and that is retention. You know, our salaries are too low. That's the bottom line. And we keep talking about this in many different committees. It's over and over and over again. It's a hot potato, but it is a big potato. So retention is something that we really have to figure out. It doesn't grow on a tree, so we've got to figure out where to get it.
Mr. Copey.
Thank you. To Madam Chair's point, we do have a mechanism that we're working on currently, and that is the tuition reimbursement. Perhaps we could build into that mechanism this excellent idea, by the way. Thank you very much, Madam Chair. And just wanted to make a reminder, we do have a mechanism, and we are revamping it as we speak. So maybe we could bring that idea forward. Thank you.
Question?
Mr. Shepherd, quickly.
Yeah. Do your needs get significantly greater when the children's vaccine comes online?
Well, we do have a mechanism in place. Laura, I'll let you explain.
Yeah, we have all of our nurses are trained and will be trained on the upcoming vaccine that comes on through. We also work with our MRC volunteers, which we have a great depth of that, which is awesome. We have volunteers from the Meta Health nurses that come in, the community nurses that will come in and support us that are also trained on pediatrics. And and we also work with all of our nursing schools, including Northern Illinois, outside of our county, so Aurora University, Waubonsie, and Elgin Community College. Those nurses will be coming, students will be coming in to support us as another opportunity. And then beyond that, we will then look for agency nurses if we need to still continue to fill. But right now, our community has been just very, very supportive of helping with these vaccines right now. And so we've had very minimal use of agency nurses from us.
Thank you.
Okay. All right, let's move on to animal control. We have Brett on the line still, I believe. Brett, go ahead. I think you're still on mute.
Brett, *6.
You hear me now? Hello, sorry, everyone. To piggyback on something we just talked about, employment. My warden position has been posted for over a year. We've had only 3 people that actually were able to interview for the position, and it was not what they expected. The people we did have apply with the experience we're looking for all heard the money and did not even come to the interview. So we are in a similar position where our pay is so low, we can't bring in the qualified people we need at this county, or even the people we're willing to train that could take this position. I do have a presentation to give today. Our statistics from the vaccine clinic have been completed, and I was able to put those together for everybody. Next slide, please. The 2021 clinic was still continued with the drive-through style, which has actually been well received by everybody that came. People were very happy. We pass out waters. We have little collapsible dog bowls for people that don't have the ability to get their animals water. So even the people that had to wait an hour, 2 hours were actually very kind, very polite. And we had a lot of amazing positive reviews from the clinic itself. Next slide. This is our overall numbers. As you can see, this year, we were able to get back to our 6 vaccine clinics per year. We take July off, so we do 3 early, 3 late. We did 4 Saturdays this year, and we did 2 Wednesday nights. Total, since we brought the clinics back to this style, has been 36 clinics, and they've been, like I said, absolutely incredible. Next slide, please. This is a great overview. You can see every year our animals impacted go up. In blue, you can see the dogs, and in yellow, you can see the cats. We're excited we're able to get the cats. Cats are actually very difficult to get those people to get out and vaccinate, because a lot of people say, oh, my cat's an indoor cat, it doesn't need to be done. Illinois law actually revamped their law about a year ago to ensure that it read cats in there. So it's important we get those cats vaccinated. Slide, please. This is a breakdown of all the animals serviced. We continue to find new ways to promote this every single year. Through the amazing Susan Stack and Tekla Metzl articles that they write, they get out into the community. We have some police officers, senior community members. I do always request if board could please pass out our flyers, that'd be amazing. We're getting the word out, and it's getting bigger and bigger every year, and it's just so wonderful to see. Slide, please. This is our dog numbers. As you can see, they're going up every year. Next slide, please, because we get the breakdown. This is our total dog service, as you can see from year to year, and the numbers going up. The column I'd like to point out the most is that senior column. 136 seniors were serviced this year. If we remember, we do free tags to our senior community. This is huge. $10 for that rabies vaccine. They're not paying for a tag. So for $10, they get a quick vet exam. They get their rabies vaccine, they get their tags, so they're vetted, they're registered, and they're on their way, and their animal's protected for a full year. So again, this is the community we're really pushing so hard into, and we're so glad that more and more seniors every year are able to take advantage of this service. And as you can see, our out-of-county numbers are actually growing a little bit too. Slide, please. This is looking at our cat numbers, and again, we're so excited these numbers go up every year. Next slide, please. Again, looking at that senior column, 58 seniors of the cat community being serviced this year. This is, again, that drive we're pushing so hard to really get these cats vaccinated
and be able to do it at an affordable rate because prices are getting more expensive out there. If we're able to provide a service to this community that could be utilized so much, we're so proud and so happy to do. Next slide, please. Microchips. This was wonderful to see. Very large jump in microchips this year. Next slide, please. Kane County Animal Control actually moved to a mini microchip. It's a little bit smaller than your average chip. It has a smaller bore needle. And what's great is we actually do the first registration. Next slide, please. Sorry, Blair. We actually do the first registration for them to ensure that their cat is registered or dog is registered in the system. Next slide, please. Again, 96 microchips this year. Total, since we brought these back in 2015 to us handling them, 312 animals are microchipped. This is so important to rehoming those animals. We can't emphasize microchipping enough. Per Illinois state law, the cost of the vaccine is $15, and by law, we have to do a minimum of 2 of these clinics per year. We do more than that. And we also vaccinate every single day if you contact our facility, microchip. We're always willing to microchip year long. These are just out of the clinics. Throughout the year, we actually do well over 100 microchips on these animals. And again, to be able to have $15 for these microchips, we're utilizing the mini, getting them their first registration done for you. It's an amazing deal that we're able to perform again at the county and how we were able to work through getting all this stuff figured out. Next slide, please. Yearly revenue, of course, the more vaccines we do, the more microchips we do, the more revenue is going to go up every single year. Next slide, please. So as you can see, from when we took them back in 2015 to 2021, it goes up every single year. Let's remember, though, we're not here to profit off this. All of my employees are working overtime here. Everyone's put in either a 35 or 40-hour week, and then we're asking them to come in above and beyond what they've already done for the week and work these clinics. And they are very, if anybody's ever been to them, they're very hectic. It's a lot of running around. It's very nonstop, but it's a very enjoyable feeling, and I know the staff feels that as well, to service so many animals and make sure this community is so well taken care of. Next slide, please. Does anyone have any questions?
Any questions for animal control? Madam Chair.
Just a clarification, please. For the out-of-county residents or individuals who come to use our clinic, are they charged an out-of-county rate or are they charged a county rate? Is it the same?
They are charged the same county rate. They would not purchase a tag. They would just purchase the rabies vaccine or microchip.
I'm just going to say,
So Brett, they do not get a tag, correct?
Correct.
Because they're out of county.
Correct. We actually send their information to their county so that their county can then reach out to them to ensure that they get registered within the county they live.
Okay, thank you.
All right, thank you, Brett, for being here this morning and presenting on what's going on with animal control. We have nothing under old business. Can I someone ask for unanimous consent to replace the reports on file? To place the reports on file.
So moved.
Any
Strathman seconds.
disagreement? Okay, the reports are on file. No need for executive session or new business. We do have one public comment. So if sorry if I don't pronounce it correctly, Sherry DeShazo or DeShazo? DeShazo.
Thank you, Chairman Sanchez.
If you could just say your name and the organization you're with, please.
Yes, I'm Sherry DeShazo. I'm a nurse of 35 years, a new resident of Kane County, and the president of Advocate Sherman Hospital. For more than 130 years, the region has relied on Advocate Sherman Hospital, and we've upheld our commitment to provide safe and high-quality care to those in need, and we will continue to do so. We're immensely proud to serve Kane County and its residents, and we appreciate your partnership as we do so. Time and again, we've demonstrated the strength of our collaboration, and most recently during the pandemic, partnering with Kane County Health Department to ensure all of our emergency responders and more than 2,500 teachers and the staff of U46 School District got their COVID-19 vaccine so they could serve more safely as well. In fact, Sherman Hospital has administered nearly 50,000 doses of vaccinations to our community. As your valued partner, I want to provide an update on the recent anesthesia transition that occurred at Sherman Hospital. My goal is to set the record straight, as I'm sure you've heard a lot. Please know that the health and safety of our patients has and will always be our top priority. Unfortunately, in September, we had to make the difficult decision to change anesthesia providers after many months of ongoing negotiations. And that transition involved a series of disruption and some setbacks. However, if you walk through the halls of our hospital, through the doors today, you'll see patients getting the care they need. Our ability to perform elective procedures and surgeries is growing daily. It's important to also know that our labor and delivery services have continued uninterrupted. In fact, in September, during the height of this transition, more babies were delivered at Advocate Sherman Hospital than in August previously. We've also continued to care for all patients who've arrived through our emergency department. In fact, over 70% of trauma patients arrive via personal transport. In September, we went on intermittent ALS bypass when it wasn't deemed clinically prudent to accept additional patients brought in by ambulance. Many hospitals often periodically go on bypass. Advocate Sherman in the past decade had been on bypass twice. Never once was the hospital without the services of anesthesiology on the premises. Since mid-September, we've had no further need for bypass. And last week, the Illinois Department of Public Health restored our level 2 trauma certification designation. Moving forward, I know our new anesthesiology practice will allow us to continue our long history of serving our patients, to grow with our community and offer expanded access and flexibility for our patients. We expect that by spring, we will exceed our prior levels of anesthesia coverage. We are grateful for the time and opportunity. I'm grateful for so many partners in this room that I'm seeing in person for the very first time, but we've worked closely together throughout this pandemic. Thank you all so much for your time. And I look forward to joining this meeting because it's been so informative as a member of this community, a citizen, and a leader. We appreciate the opportunity to be with you today. Thank you.
Thank you, Mrs. Shazo. I know that's a subject we're all aware of, and it's good to hear that there's a resolution achieved and things are looking good. So thank you for coming and reporting on that today. We appreciate it.
Thank you so much.
Mr. Chair,
Mr. Tepe.
I'm reluctant to say this, but I think it needs to be shared, okay? The recent actions that have occurred at Sherman Hospital have created a lot of angst in the community around Elgin. It would have been much more appropriate for everyone to really have been truthful at first. And even though elective surgeries are the ones that are being delayed, those kinds of surgeries are in often cases very important. I know a friend of mine has had their surgery not only delayed, but moved to another location. And I think it's important that even though Sherman Hospital in particular has really done a phenomenal job in other areas, this is one area where I think they've let the community down and could have done a much better job of being upfront and truthful. And it's disappointing. And I know they're out now trying to cure it from a public perspective. But there are a lot of people in my community that are still concerned. So thank you.
Thank you for your comments, Mr. Tepe. If I could get a motion and a second to adjourn.
Moved, Shepro.
Shepro moves.
Wallace second.
Give it to Wallace online. All those in favor say aye.
Aye.
We are
Aye.
adjourned.